Good evening, and welcome to another hour of healthy conversation provided by your Health Advocacy Ministry. Our topic today will be colorectal cancer detection and prevention. My name is Tameka Hairston, and I will be serving as your host. We will have two on our panel today. Terry May, who is a colon cancer survivor and a member of Faith Ministries Church, and Dr. Stephanie Bolden, nurse practitioner who specializes in family medicine. We'll first be hearing from Dr. Bolden, after which time we'll hear from Terry May and allow her to share her story. After that, we will open it up for questions from our listening audience. So, I'd like to introduce Dr. Bolden to you. So, Stephanie Bolden has been a registered nurse for 22 years. She has a Doctor of Nursing degree and just completed a postgraduate certification as a family nurse practitioner. She will be taking the board certification exam really soon. Good luck. She is an assistant professor of nursing at Mount Sinai Joseph University in Cincinnati, Ohio. She enjoys teaching nursing students and has a sincere love for caring for patients. Rendering care to the sick is her calling, and she takes that very seriously. She genuinely has a love for what she does. She is the co-facilitator of the Health and Wellness Ministry of Christ Emmanuel Christian Fellowship, where she has been a member there for over 25 years. Please join me in welcoming Dr. Bolden to the table.
Thank you. Thank you so much, Tameka. Thank you. Okay. All right. So today we're going to be talking about the importance of screening for colorectal cancer. And I'll go through my presentation and with the main focus on how important it is to actually be screened for colorectal cancer. So the beginning slides will just introduce you to what colorectal cancer is. And then, like I said, my focus will really be on the importance of screening. Okay, and then we'll have our survivor share from their standpoint. Okay. So again, understanding colorectal cancer, what it is and why it is so important to be screened. And you can go ahead and advance to the next slide, please. All right. So I'm going to give you some really astounding information about colorectal cancer. Not a lot of people really know what it is, or, maybe they heard that someone recently died from the disease, but not a lot of people know what it is. And so in the United States, colorectal cancer is the third most common cancer in both men and women. But it is preventable, and that is what we want for people to know and understand. It is definitely preventable. Okay, regular screening for removal and growth of in the colon, called polyps, reduce the risk of developing colorectal cancer by up to 90% by having a colonoscopy. Okay, and there are certain guidelines as to when that colonoscopy should be done, and we'll talk about that a little bit later. So just as a good slide, just so you can see what types of cancers are actually preventable. So prostate and breast cancer, they're not, even with screening, but colorectal cancer is a common cancer that you can prevent with adequate screening. So we can go to the next slide. Why is it important? Well, you can prevent, not just detect, colorectal cancer with a screening test called a colonoscopy. And when people hear colonoscopy, they've maybe never had one, but they just know having a colonoscopy is probably not the most delightful type of procedure. However, it is proven to be quite effective. So what happens with the colonoscopy, the removal of precancerous growths within the colon, those polyps, right, reduce the risk of colorectal cancer. All right, so the power of prevention is definitely by having those timely colonoscopies. So we can go to the next slide. Again, this is information. We like to look at evidence-based practice. So from governing bodies or our scientists, our physicians or specialists, and according to the physicians from the American College of Gastroenterology, screening by colonoscopy and polyp removal prevents colorectal cancer before it can even start. So why not be screened, right? So this, again, is some information. It's a little bit involved. It has pictures and everything, but it does bring, again, to that very important point of how colorectal cancer starts. It starts as a benign growth, and as we know, benign meaning non-cancerous, and that's in the form of a polyp. Okay, it starts from the innermost layer of the colon, right, which is along that mucosa. If cells spread to that first layer below the mucosa, then the cancer is present. So again, if we can catch it by a colonoscopy, then it will definitely be quite important to get that procedure done, right? The recommended time frames. Again, here's some little information about colon polyps, what they are, what they're made up of. Maybe some people that are here joining us today, maybe you've had a colonoscopy and have been told that you have polyps, and people really don't. Sometimes people go away and say, what are polyps? I get a lot of calls from family members, church family, friends. What are polyps? And here's some information about what colon polyps are, right? They're harmless. They can develop into colorectal cancer, which is often fatal if it's found in later stages, guys. Again, why it's so very important that we get that screening. Not all polyps turn into cancer, though, but all cancers start as polyps. But how would you know if you have a polyp if you don't get the procedures, the tests? Polyps don't usually cause symptoms, so it is important to regularly get screened so that we can visualize. Not say we, I don't perform the colonoscopy, but so the physicians can visualize these polyps and remove them as they need to. Okay, we can go to the next slide. Okay, so again, this is just information that supports the fact that screening tests can find these precancerous colon polyps, and they can be removed before turning into cancer. All right, some more information about colonoscopy. So colonoscopy is the only screening test that allows both identification and removal of polyps. So there are some other tests that can be performed. I know seeing patients in the clinic, I'm like, I need to give you a referral for a colonoscopy. It's time. And they're like, I don't want a colonoscopy. Is there anything else I can, utilize, or what else could I do instead of that? And so there are some alternatives, and we'll talk about that a little bit later in the presentation. But removal of polyps, again, prevents up to 90%. You're good. Thank you for that. Up to 90% of cancers, potential cancers. Understanding who is at risk, and this is important. You can go ahead and advance the slide. Now, this is important because some people are thinking, well, I'm a woman, I can't get colorectal cancer. Yes, colorectal cancer affects both men and women. 1 in 23 lifetime risk of colorectal cancer for men, and 1 in 25 women, right? Lifetime risk of colorectal cancer for women. Estimates show that people born around 1990 have twice the risk of colon cancer and 4 times the risk of rectal cancer than those born around 1950. Look at those numbers. So again, it's very complex. Experts say that maintaining a unhealthy diet and sedentary lifestyle may contribute to these alarming numbers, right? So again, some really impactful information. We can go ahead and advance. Here's some other factors that can further increase the risk. Family history of colorectal cancer. Definitely, we look at that. Anytime a patient has the development or visualization of polyps on their colonoscopy, we're always asking, is there a family risk? Do you have a family risk of colorectal cancer? A family history of adenomas, which is another form of cancer, um, or precancerous tumors, cigarette smoking, right? Cigarette smoking, obesity, the removal of your gallbladder, physical inactivity. So that's that sedentary lifestyle. But it's getting nice out, right? So this is a great time for people to start getting back to being active. Cancer of the uterus or ovaries before the age of 50. Inflammatory bowel disorders such as ulcerative colitis or Crohn's colitis, and the African American race, which definitely we're going to be focusing on some information that about our African American population. So again, we're going to go briefly through this symptoms of colorectal cancer. We can go ahead and advance the slide. Most early colorectal cancers produce no symptoms, which is the scary part. This is what makes this such a complex cancer, is you don't have any symptoms. And generally with cancer in general, we don't always know that there's a risk or a development because there's no symptoms with some of the cancers. But definitely for colorectal cancer, there may be no symptoms. However, if you start developing symptoms or bleeding in the stools or abdominal pain, you never, ever, ever ignore new or worrying symptoms. So if there's something new within your body, you always go to follow up on it. So we tell patients, don't wait all to go away. I'll take some ibuprofen. No, you always follow up with your care provider. Okay, if you have any symptoms, regardless of your age. Next slide. Should I wait until I get symptoms? Again, that just piggybacks off of the previous slide. Do not hesitate to talk to your healthcare team about symptoms. And here are some of those symptoms. If you can see them, I'll go ahead and read them off. Blood in the stool, a significant change in your bowel habits. So again, really monitoring when your last bowel movement was, the consistency of your bowels, change in the shape and size of the stool, any type of rectal pain, abdominal pain, unexpected weight loss. That's a biggie, really important. And unexplained or new anemia. And anemia is like low blood count, your fatigue, maybe you're having some nausea, some vomiting, you're just always tired, maybe you're very cold, and anemic. All right, so you can go ahead and advance to the next slide. Thank you. So no, you should not wait. Get screened. What should I do if I don't have any symptoms of colorectal cancer? Get screened. It means getting checked even when you have no symptoms. Next slide. Next slide again. So here we are. We're going to talk about some of those ways that screening can be performed. So again, the first one is the colonoscopy. And this is a one-step test that looks for growths called polyps. And we talked about polyps a couple of slides back. Polyps in the entire colon, which is the large intestine, and rectum, using the colonoscope. Your doctor can both detect and remove these polyps. And that is the great thing. While they're in there, they see polyps, they can go ahead and remove them, right? And prevent colorectal cancer. It is the most commonly performed gastrointestinal procedure in the United States. And it offers long-term protection against developmental colorectal cancer or dying from it. Grab some water here. Excuse me. All right, so here are some other tests, and these are more like two-step screening tests, and these are stool-based tests. And I've sent patients at the clinic home with these particular tests. And it's a FIT test is probably the most common one that I've given. And then the other one is a multi-target stool DNA test. And again, these are non-invasive. With the colonoscopy, we place patients in the twilight where you may even be put to sleep with the colonoscopy. You're definitely in the twilight. You may hear numbers, but you're not really aware of the discomfort. The two-step is, again, a stool-based test that patients can perform on their own. And then they'll mail in the sample of stool tests, or they take it to the clinic, wherever your clinic is. And so these are two alternative ways to test. Okay. Now, if any of those two-step tests were suspicious, then a follow-up colonoscopy would need to be performed. Okay. And again, you have a one-step test, and this talks about the colonoscopy, and then the two-step test. So it just really reiterates. So again, anytime a two-step test comes back with suspicion of any type of polyps or the need for further testing, then a colonoscopy will need to be performed. So it is a great alternative, just rather than going straight into the colonoscopy. So patients do have a choice. The recommended frequency for the different screening tests. Here we are here. The colonoscopy, and some patients are really in agreement to this. Colonoscopy every 10 years, right? Every 10 years, as long as there's no other issues. Now, if there's a family history of colorectal cancer, sometimes that colonoscopy may be a little more frequent. So it all depends on the patient history. But according to the most recent clinical practice guideline, the colonoscopies are performed every 10 years. And then the FIT test is every 1 year. So it's a little more frequent. So every annual physical, I'm sending my patients out with the FIT test packet for them to mail their sample back in. Okay, and then there are some other alternatives there. The multi-target stool DNA, which is every 3 years. A flex sigmoid scope is every 5 to 10 years. And again, these alternatives might not work for each and every patient, but there are alternatives. You have a CAT scan colonography, which is every 5 years, and then a colon capsule, which is every 5 years. So I'm most familiar with the FIT test, and then the colonoscopy. I've had some inpatients get the flex sigmoid. We call it a flex sigmoidoscopy, and that is every 5 to 10 years. But again, it can be more frequent if the patient is having issues. Okay, you can go ahead and advance the slide. Screening for African Americans. African Americans are diagnosed with colorectal cancer at a younger age than any other ethnic racial groups. And so I know I've been involved in health promotion and disease prevention within various communities here in Cincinnati, which is where I live. And the focus has been on our African American population. First of all, educating the population about colorectal cancer, and then the importance of screening. African Americans with colorectal cancer have decreased survival compared to other ethnic and racial groups. Okay. So the ACG guidelines recommend colorectal cancer screening in African Americans starting at age 50. Otherwise, the starting age is starting at age 45. The general population, if you're not African American, the age to start screening is 50. So African Americans is 45, and that is fairly new information. And so I find myself trying to get everyone who is below, all my African American patients below the age of 50, they're, 45 and up. Have you gotten your colonoscopy? Have you gotten your colonoscopy? So we're still playing catch up and really, really stressing this importance. So it can be prevented. We just have to get everyone on board. Screening for patients with a family history of colorectal cancer or polyps. Again, we want people to get, first of all, to make your healthcare provider that there is a family history or you do have a history of polyps. Again, your need for a colonoscopy is going to occur sooner than that every 10 years. As you see there. Sometimes genetic testing may be required to determine a risk of colon cancer. I've had many of friends that don't know their family history, or maybe they think they have a family history, and some of those individuals have been referred to for genetic testing just to make sure, especially when there's a younger age of an infective relative, because people want to know, and I think that's great. All right, so getting a screening test schedule. Let's keep going here. How can I arrange a colorectal screening? Okay, so again, everyone should have a primary care physician, and know the emergency room is not your PCP. Get aligned with a primary care physician. It can be a physician, a nurse practitioner, but be affiliated with someone that you trust that can get you all of these tests and screening that you need to have. Develop a trusting relationship. Get to know your care providers because it's very important. And really, depending on how old you are and what your risks are, they're going to get you all up to date on all of these screenings. And actually, insurance companies are really Medicare, Medicaid are making it. I can't even think of. I kind of went off with this on the slide, but what was I going to say? Reimbursement, value-based care. That's what I was thinking about. But value-based care determines, are doctors referring patients out to get these adequate screenings? Are they getting the tests that they need? Mammograms, colorectal screenings, all different types of tests, hemoglobin A1C to monitor for diabetes. So all of these tests are recommended screenings every so often, and it's considered value-based care. So that means providers are going to be getting reimbursed or paid based off of the particular test that they're ordering for their patients. So really, it is a great idea to make sure all of our patients are getting the adequate amount of screening and tests so that we're keeping our patients healthy. So really, you can talk to your healthcare provider and they can refer you out to a gastroenterologist. Again, we talked about those symptoms. Also, those abnormal symptoms that would bring suspicion that you're having some issues. So first off, talk to your healthcare provider, okay, and they can get you a referral. All right, we can go ahead and continue on. So again, getting screened means you're taking control of your health, guys. And I'm talking to myself because I'm right up there. I need to be making an appointment, getting screened. Although I know that the prep is no fun for a colonoscopy, but it's temporary. You take your prep, you clean out the colon, you go in for your tests, you get to recover for however long it takes you to recover, and you get to go home. It is a preventative health screening, So that means you're preventing the development of cancer. So I'm talking to myself, I'm talking to our audience. Get screened. That's the most important thing. Don't be afraid. I'd rather know than not know, but get screened, and that's the most important thing. Know it, no excuses. No excuses. All right, let's see. We're almost done. Your excuse to avoid colonoscopy. Some people are like, I feel fine. I don't have any symptoms. Remember what I said? You may not have symptoms. Again, cancer, early colon cancer can develop silently without symptoms. So knowing that, we do not want to wait, right? There's more of a chance for survival if we catch it early. Okay? The later we catch it, the less likely it's going to be curable. All right. Go ahead and continue. There's another excuse. I'm healthy. These are just excuses. No one's going to use these excuses, right? I'm healthy. Why do I need to get screened? I've heard patients say this all the time. I don't need this. I'm fine. Well, you know what? You fit in my age. You fit in the age criteria, and you have a family history. You need to get screened, right? So I have to give them the spill. And most of the time, patients they're like, okay, because they trust you. So again, as healthcare providers, our patients need to trust us. So I'm big on being real, keeping it real. And, I don't want to scare people, but I like to keep it real with patients and I have that sincerity that I want all patients to be healthy. So get screened. No one in my family had colon cancer. And I say this very thing. That's my communication bubble. And don't be the first, right? Don't be the first. Roughly 5 in 100 people are destined to get colorectal cancer. Don't be that 5 in 100, okay? Even with no family history. I have no risk factors. The single biggest modifiable risk factor for colorectal cancer is failure to be screened, right? So that's a risk factor in itself. That's a good slide. Next. Only men get colon cancer. This should have been a test question. That's a false statement, right? Colon cancer is an equal opportunity disease. Women have the same risk as men. Get screened. All right, next. And this is what a wonderful family portrait there. And if you value your family, you love your family, don't wait, get screened. And I thought this was a very adequate slide that I added here. Don't wait, get screened for colon cancer. And if you're African American and age 40 plus, you should be asking. Even if your health care provider has not mentioned it to you, you should be asking to get screened. And I believe that's it. Thank you so much for your attention. Again, I wanted to have time for our other speakers and then also for questions. So thank you for your attention.
Awesome. Awesome. Well,
Yes.
thank you very much, Dr. Bolden. That was excellent, excellent information.
Yes.
And I hope that someone truly heard. And if you are age 45 and up,
Yes.
hopefully you are on your way to a telephone to call to get your appointment scheduled. Right now, we're going to turn it over a little bit, and we're going to have Terry May to kind of share with us her story. We know that you are a colorectal cancer survivor, and just tell us a little bit, Terry May, about how did it all come about? What were some of your symptoms? When did it happen? And what were some of the things that you went through, and where you are today? Do you still get screenings now? What things did you do? How did this change you?
Back to the beginning. I just turned 50, and I went to see my doctor for my annual checkups, and he said, "Well, you're at that age. It's time to get your screening." And I was like, "Oh, no, 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 no. I don't want to do it." But I said, "Okay, you're right. I'm 50 years old. It's time for me to start checking those things." So I knew all about it. My mom always did them. You know, it was no big deal. So I was like, all right. So I went and got my screening, and I'm waking up in recovery, and the doctor says, you have almost a complete blockage. And I was like, what? You got to be kidding me.
Wow.
I was fine. I didn't, I was still going to the restroom. I mean, once in a while, I had a little bit of constipation, but I really didn't feel bad or anything. So from there, I had to go. They took a sample, and then I had to wait. I think it was about a week and a half. I went and saw a surgeon, and he said, it's cancer. We don't know what stage you're in, but it is cancer. So we need to schedule some other tests. So I had a CT done, and they saw it all in there, and they said it was pretty big, and they saw some spots on my liver. So I was like, wow, this is everything was just hitting me so quickly. I was basically in shock. And so they scheduled me the surgery. They removed 8 inches of my colon, and they immediately got me on chemo. I started taking chemo. They said I was in stage 4, and I was just blown away. I could not. I had no. It never runs in my family. We didn't have any cancer, colon cancer in my family that I'm aware of. I mean, my father, I don't know his side, but I know on my mother's side, there's nobody. And so I went through a lot. So I did 6 rounds of chemo. Then they had me stop for about a month, and they had to shrink down the little nodules that were on my liver. So they shrunk those down, and then I had major liver surgery. So they removed 75% of my liver. Thankfully, your liver grows back 15 to 20%, which is awesome. So, and then after the surgery, I had to wait a little bit, and then I went back and did 6 more treatments, and I finished all that, and I was cancer free. And I did, let's see, I did a CT scan every 3 months for 3 years, and then the last 2, it's been every 6 months. And I praise the Lord. I got one more coming up in April, and I pray that it's good and I will be clear. So that will be my 5 years. And I'm going to
Wonderful.
tell you,
Wow.
it's a scary thing
Amazing.
because
That is
I
amazing.
know, I know, and it could have
Oh
been
Wow.
a
my.
lot worse. And
Yes.
I thank God for keeping me
Wow.
on this earth. I know He has a plan for me. So,
That's
but I
right.
just, and my
Wow.
doctor, I kept telling him he was the doctor of, he always brought me bad news. It was every time he came in, I just felt my heart sink. It was like, what are you going to tell me
Wow.
now? I just, I was just, I prayed and
Wow.
prayed, get me through this, Lord. I need all your strength.
So it sounds like you were doing the right thing. You were at the age of 50. You were
Mm-hmm.
following that those normal protocols, seeing your family physician, no
Yes.
symptoms,
Right,
doesn't run in
right.
your family,
Mm-mm.
and it was and it just you found it. So that I mean that
Yeah,
truly in
yeah,
and of itself, as Dr. Bolden had alluded to, is that's a blessing that you went
Yes.
yeah.
early.
She
You
got
were able to
screened.
be, you got
Mm-hmm.
screened, you were able to be
Mhm.
treated, and now you're
Mm-hmm.
back on your road to recovery, which is absolutely
Yes.
amazing. At this
Yep.
point, once we finish our last rounds and all that good stuff, what's next? Do you have a how often
I,
do
I
they
s-
recommend then
every
you
three
get
years.
screened? What every
Okay.
three?
Every three
Okay,
years, I do a colonoscopy. I actually got one probably coming up. Um,
okay.
so I'll have to do another one. But you know, I try to watch what I eat now, and since it's COVID, I haven't really exercised a lot, but I really need to. I put on some weight, who
Hmm.
hadn't through the, you know,
Yeah.
COVID. But you know,
Yeah.
I feel okay. I'm working part-time. I am on disability because my doctor wants me to stay on it for a little bit just to make
Yeah.
sure everything's still good. You know, watch your stress, things like that. But
Okay.
yeah, I mean, definitely get your
Nice.
screenings. That's the number one thing. Number one. I mean, I can't stress it enough
Yes.
to get your screenings. You know, I
And
get my whole body. I get CT
That's
scans
right.
every 6 months now. It's like they check
right.
everything. So, and I still, you know, I do
Right.
my breast examinations. I get those
That's
mammograms.
great.
I'm on top of it. You
Awesome.
know, I just lost my
Awesome.
mother 6 months ago or 5 months ago
Oh,
to
Oh.
she had uterine cancer.
yeah.
Oh.
She started out
Oh.
having breast cancer. She beat it,
Hmm.
but the tamoxifen they gave
Oh.
her,
Yep.
there's it
It's
ended up giving her,
carcinomas. Cause of cancer.
yes, and
Yeah.
Wow.
so they did a hysterectomy and they thought they got it all, but it came back, and you know,
Mhm.
yeah, didn't make it,
Yeah.
but
Okay.
you know, she's always been on me. You get your test, you take care of
That's
everything.
Good.
good. That's great.
Good.
I'm
Hmm.
That's
glad you
great.
listened to
That's
mom.
great.
Yeah.
Yep.
Absolutely. So I have a couple questions, and both of you, you mentioned it. You mentioned Terry that you watch your diet, and Dr. Bolden, you mentioned diet being important in one of your other slides. What types of is there a certain diet that Terry that you follow, or and Dr. Bolden, is there a certain diet that you recommend? What's the recommendation to prevent all of this or to help with prevention?
I would
Well,
recommend, and I recommend for so many of my patients, because I see a lot of people with diabetes, hypertension, heart healthy foods. If it's good for our hearts, it's good for the rest of our bodies. So lower in salt, definitely low cholesterol, low fat foods, vegetables. So, eating green foods, healthy foods, not a lot of processed foods. So I like hearty, healthy, natural foods. I always call it like clean eating. And again, like I say, I talk to my patients and I'm always talking to myself too. So I'm not going to tell my patients anything that I won't tell Stephanie, right? And so, and like Miss Terry said, with COVID, a lot of us have been shut in and just haven't been able to get back out there. But I'm so grateful, even myself, to be able to start getting back active and changing my diet, and I feel so much better. I have energy. It has been proven that if, we cut something bad out of our diets, one thing every week, how much better we'll start to feel. So I'm saying like low fat foods. You don't have to go to the store or throw all your foods you have out now unless you have a lot of bad food, but it should be healthier food. Think about what you're putting in your bodies, right?
Right.
But vegetables, fruits, if as long as people can tolerate it. And then keeping your
hmm
bowels moving. So if you eat a lot of
Hmm.
vegetables, your bowels are going to stay regular, and just
hmm
keep everything flowing, drinking plenty of water, right?
hmm
Non-sugary
hmm
foods, non-sugary drinks, and keep everything flowing. That's what
Okay.
I would definitely recommend for sure.
Okay.
Yep.
Okay.
With
Thank you.
me, I stay away from. I'm sorry.
That's
Go
what I was
ahead.
going to ask. I was going to ask Terry, what type of foods do
What
you,
did?
and
Yeah.
you're regarding what type of foods do you
Yeah.
take in?
Well, I'm actually celiac, so
All
no
because of your
issue.
liver. Hmm.
Well, no, it
Okay.
was before that. I was
Oh,
celiac
you
before
were?
all of this.
Oh.
Hmm.
Oh wow.
Yes.
Oh, wow.
Wow.
Okay, so
Yep.
you already
So,
Wow.
have a pretty strict diet.
Diet that you
yep,
have to
yep.
follow.
So, and it's
Hmm.
really
Gotcha.
hard to get
Okay.
enough fiber as a celiac
Yes.
person. So, you have to do the fiber chews or, something like that,
Mm-hmm.
beans, try to do those things. But I definitely stay away from red meats. I'm not a big
Mm-hmm.
meat eater anyways. I mean, if I do, it's more chicken and fish, and that's
Mm-hmm.
mainly
That's
what I
good.
do. I don't do a lot of pork or anything
Okay.
like that. Um,
Okay.
I try to eat vegetables and fruits, things like that. My biggest
Oh.
downfall is my coffee. So I drink a lot of coffee, and that's a bad thing. And I use the creamers and the stuff that makes it taste good. But yeah,
Right.
but for the most part, I try to eat more healthier. I do have a sweet tooth, and I have to watch that a lot. So
Mm.
So at least you
it's
Wow.
know
just
that, right?
Yeah.
yes, I do
Yeah.
know
Yeah.
it,
Absolutely.
but but I can't just go
Okay.
eat donuts because you can't really find those gluten free very often. So
No,
Not
so
often.
how I
Not
would
often.
love to eat a
no
donut, but I
donuts.
just can't. Right.
Okay. All right. Well, thank you for that. There is a question in the chat for Dr. Bolden. Can you comment on Cologuard?
Okay, let's see here. Um, Cologuard is another one of those, and I actually have my little thing here. Because I was actually I had a friend from my church who asked me about Cologuard here just 2 days ago. So Cologuard is another type of test that can find colon cancer in early stages as well. It finds 92% of colon cancers overall, right? Um, it can find stage 1 and stage 2 colon cancers. So Cologuard, I'm sorry, my ear was ringing. Cologuard is a proven test as well. I'm not super familiar with it, but it definitely detects the altered DNA and blood in your stool. So again, it's another one of those stool sample tests. But it is it
Is that
is
one that you
definitely
can do at home? Is
yes.
that one that you do at home where you send the like you had mentioned the two step test and the one step
You
test.
can
So I
use it
know
at
that those
home.
were
It's a
at home.
Yeah,
Okay.
so it's a non-invasive test. You can use it at home. There's no special prep, no need to be off work. Usually people who prep for the colonoscopy, you have to Terry, you probably
Really?
remember this, you have to kind of stay close to a toilet, right? Or
Toilet?
but
Mm-hmm.
the Cologuard is
Yes, you
delivered
do.
right to your doorstep.
Right.
You collect your sample and your private in the privacy of your own home, and the fit test. Those other at home tests are very easy to use as well, and they come with directions. They're really easy to use. Yes.
Dr. Bolden, for those tests, is there any? And I know you said they're non-invasive, and and it's done at home. Do you have to do any special prep though, or do you just gather a normal stool sample? So
A
come
normal
home from
stool
work
sample.
or whatever,
Yeah.
Okay, okay,
So what I usually if I send someone home with, because I guess some of these tests you can probably just call the customer care and get one sent to your home. The only thing is, if I had someone come in the clinic, I would give them a receptacle to catch the
oh,
stool, right? Maybe a
yeah,
pair of
yeah,
gloves, maybe a
yeah.
little a stick or something, to kind of keep it. I mean, we do it in the hospital. We kind of glove up and get it. But at home, nobody wants to. It's kind of yucky to even think about. And so some people are like, I'm not doing that. But so I will always
Right.
send like a container for them we call it like a hat that you place in the toilet.
Mm-hmm.
So if you get it from your doctor's office, they can give you the receptacle, and then they can, give you the apparatus to kind of spread it on the card or put it inside the cup or whatever. In the
Cool.
privacy of your
Okay.
own home, right? If you mess up, nobody will ever know. Right.
Right.
Yeah.
Right.
Yeah.
Another question in the chat. How often should you get a colonoscopy?
So colonoscopy, like I said, is every schedule every 10 years, as long as you don't have any other risk factors. So for some people maybe who've had polyps in the past, they may have a colonoscopy more frequently. I believe Ms. Terry said your colonoscopies are how frequent now?
Every
Every
3.
three.
Yeah.
Every 3
So
years.
again, every 3 years. So I have some patients where I'm having them go every 5 years. So again, every 10 years though, as long as there's no other issues, every 10 years. So we can do that. Again, I'm
Mm-hmm.
talking to me too.
Absolutely.
This would be my very, very first one, right? And I'm like, I can do this. I can do everything else. So I want to live. I want to live. I want to be able to enjoy my grandchildren that I don't have right now. And I just want to live. I
Right.
want to be able to enjoy life and live. So
Mm-hmm.
I'm going to get my colonoscopy and then I'll see you again
Right.
in 10 years. Right.
You should. You should.
Mm.
And they're
Yeah.
not as bad as everyone says they are. A good thing
The
about,
procedure's
well,
not
the
bad.
prep, correct. You
That's the
would
prep.
never know that you had it. You would never know.
Mm-hmm.
And many of the physicians now are moving more toward the Go Lightly, that big gallon drink,
Yeah.
because it's said to have cleaned you out a little bit better. But if you think of it this way, if you do that Go Lightly, that gallon of loveliness one time, and you do it correctly, you don't have to repeat because you didn't
That's
get yourself
right.
cleaned
So
out.
don't cheat.
So think
Yeah.
about
It
that.
needs
Don't
to be
cheat
clean.
don't cheat
Yeah.
yourself. Don't cheat
But you
yourself.
know what I tell
Awesome.
patients? I tell patients too, take it as an opportunity to clean out that colon and you get it all clean and start some good healthy eating habits. It's like a cleansing, a colon cleanse, right? For a
Mm-hmm.
good
Right.
cause. And then from their point there, moving forward, watch what you're putting in your mouth. That'll be a great way to
Right.
start being clean, eating better.
Okay.
That's how I look at it. Yeah.
Right. Now,
Absolutely.
I just have one other question, and this is for both of you because I know, Miss Terry, you said when you had went in and they told you you had a complete blockage, a complete bowel blockage, and were you constipated at the time? I mean, it sounds like you did your prep and you were clean, but the blockage was that polyps blocking. What? I'm sorry.
It
What
was
was
it
it?
was a tumor that was blocking.
It
It
was
was
a
a
The
tumor.
tumor.
tumor
So
was blocking.
yeah,
Gotcha.
it
Okay.
was. They couldn't get the scope all the way up through because it was just
Wow.
so
It was
big in
it
there.
was that big.
Yeah,
And
So
were your
stage
yeah.
4, you
stools
said.
impacted by that?
It was stage.
Were the stools impacted
No,
by that though?
actually, it was almost a complete blockage. They said almost. So that it was still.
Oh.
Stool was actually making it through.
Passing. Mm-hmm.
Yeah,
Hmm.
but yeah, it was.
Okay.
That's why I
Wow.
was like,
And
I didn't realize it.
formed stool. I mean, I know this is it. Was it formed stool that was able to get past, and not
Yeah.
diarrhea type?
Nope.
Wow. Amazing.
Yeah,
Amazing.
it.
Well,
Yeah.
God surely had his fingers on you. And we are
Yes.
very,
Absolutely.
very, very grateful and glad of that. Um, are there any other questions in the chat? I didn't see anything that came through.
Mm-mm.
Awesome. Well, I wanted to take time to say thank you, thank you, thank you to both of our panelists today. The
Mm-hmm.
information that you shared, Dr. Bolden, has been extremely, extremely helpful. To
Yes.
hear your story, Terry, has been
Yes.
Hmm.
absolutely, I think, helpful to know that, like you said earlier, there's so many people who say, I don't have a history of that. I feel fine. You are living proof that, yeah, you felt fine too. You did not have
Yeah.
a history, but you got
Yes.
Right.
tested. And because of that, look where you are today. So,
Saved my
Amen.
life.
That's great.
seeing that there are no other questions, again, thank you to both of our panelists. Thank you for those
Thanks for
listening
having
out
me.
there.
Yes.
And hopefully you'll
Thank
take
you.
something away from this conversation. Again, thank you, thank you, thank you.
Thank you for having me. It was
Thank you.
wonderful. Bye-bye.
Bye.